This is like a really big time of your life. So what I always recommend women do is make a few appointments with different ones, different hospitals, depending obviously on what your insurance covers.
Right.
But shop around, see if you can meet a couple of doctors, and you might think, actually, I really liked her. I really gelled with her. I feel comfortable. That's done. And you want to, if you kind of know what direction you want your birth to take, so some people know they want an elective cesarean birth.
Okay.
Fine. Some people want a water birth. You need to talk to them fairly early on about what your preferences might be, because some OB-GYNs don't do water birth. Some OB-GYNs will say, no, I don't think you need an elective C-section. You know, you want their values and their like beliefs to be aligned with yours.
Right.
And if they're not, you're just going to waste your entire pregnancy fighting a battle that you're not going to win.
So we try to kind of
all these tests.
I retired, and obviously, but you know, thankfully,
Actually, I just thought of another question.
Yeah.
It's a bit related. Is there such a thing as pregnancy brain? Because like
Yes.
I feel like, I mean, everyone I know in my life has been complaining about it. So can you explain a bit more like what happens and how can you, I don't know, can you reverse it? Like, can you work on enhancing your brain muscle?
So your brain, obviously there's so many hormonal changes,
Right.
and changes to our circulatory system. There's our hormone, like stress levels, everything like this affect our brain, right, on a daily basis. Never mind if you're pregnant. If you're having a stressful day, you're more likely to forget that you're supposed to go there, or if you've got a bit of pain, you're going to be not aware of like what you've said or what you've done, perhaps.
Of course, yeah.
Baby brain is real. It's been proven.
Okay.
Right, by researchers. And when we have a baby, our brain permanently does change in the way that it's almost like the brain is rewiring itself to be a parent.
Okay.
So we know that people can be sleeping soundly, and I could like walk in, bang in some pots together, and they might not stir. If the baby makes a little tiny noise, like, oh, they're awake straight away.
Yes.
Like our brains are then in this kind of new state, yeah, where the priorities are different to what they were before. And it's perfectly fine to have baby brain.
Okay.
You can't not have it. If you've got it, there's not really anything you can do. The only thing I recommend to people who are really struggling with it is leave yourself voice notes, like record stuff. So especially when you go to doctor's appointments or you go to see a midwife, just say, can I just record this because I'll forget it all.
Amazing.
And then you can go home and listen to it.
I like that.
Yeah, because I always get people coming to me and they're like, so the doctor said this thing and I can't quite remember what it was. And I'm like, I'm going to need a bit more information.
Yeah, I know. I need more than that. Like, exactly.
So I always tell them, like, record everything.
That's nice. I like that.
And also if like your partner can't come to an appointment, or you're just at work and you're like having a conversation, you can't remember it, write it down, put it in. I prefer voice notes. I'm that person.
Okay.
I'll send someone a 15-minute voice note because I can't be bothered texting. But
yeah, same. Yeah.
yeah, so things like that will help you.
Okay. And
then in the postpartum, I would just say for the first 6 weeks, don't expect anything of yourself in that, like, I need to remember to go here, there. I need to remember to do this and this. It's like, just be in that postpartum period and get through it, however works for you, and then figure the rest out.
And I think it's part of the support that you get from your family and your friends is to cut you some slack. I mean, they need to know that, you know what, I have a human being growing inside of me, so like, just take it easy.
Yeah, like you sat there going, I'm literally making like some ears right now.
Exactly.
Just give me a break.
Ears are growing, so true. Okay, so in terms of the OB-GYN, what should women expect from their doctors, and what kind of questions should they be asking, and what kind of tests should they be, requesting from their doctors, and like just the follow-up, the nature of the follow-ups with their OB-GYNs. What should they be looking for?
So usually people see their OB-GYN when they first find out they're pregnant. So usually around 8 to 10 weeks, could be sooner. Some people know at 5 or 6 weeks,
Right.
But at that first contact, you want to just get a feel for your OB-GYN. So what you should expect is somebody that you feel like you gel with.
Okay.
And it's okay if you don't feel that. You can find someone that you do. So once you choose one, you're not obligated to stay with them if you're not particularly happy.
Right.
Right. And this is like a really big time of your life. So what I always recommend women do is make a few appointments with different ones, different hospitals, depending obviously on what your insurance covers.
Right.
But shop around, see if you can meet a couple of doctors, and you might think, actually, I really liked her. I really gelled with her. I feel comfortable. That's done. And you want to, if you kind of know what direction you want your birth to take, so some people know they want an elective cesarean birth.
Okay.
Fine. Some people want a water birth. You need to talk to them fairly early on about what your preferences might be, because some OB-GYNs don't do water birth. Some OB-GYNs will say, no, I don't think you need an elective C-section. You want their values and their beliefs to be aligned with yours.
Right.
And if they're not, you're just going to waste your entire pregnancy fighting a battle that you're not going to win.
Right.
And that's not something we need to do in pregnancy. As far as tests and stuff go, generally for the most part, for most people, there's not a lot of tests that you need.
Okay.
You'll have occasional blood tests to check your iron levels. There's the NIPT screening.
Okay.
They will offer you a test for gestational diabetes, things like that. But for the most part, there's not a lot that we need to do, unless there are other complications that you have medically prior to pregnancy.
Right.
Then, that if that's you, your pregnancy journey might look a little bit different to the next person's. But overall, it's not a time we need loads of tests and things,
Right.
You will usually, I'd expect if you're going to see an OB-GYN regularly, you'll probably get an ultrasound every time, which is how it's done. So
Right.
if some people don't want an ultrasound every time, which is so fine.
Okay.
You don't have to have everything as well. If you're not sure why your doctor's offering you a test, and you talk to them about it, if you're not getting the benefits, the risks, the alternatives, and time to go away and think about it, then that's not appropriate care.
Yeah.
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 So you should always come away from your OB-GYN thinking, all right, they offered this, they explained why. I've spoke to my partner about it, and actually, we think this is a test that we will be happy to have.
Okay.
And it's really important to remember, for the most part, OB-GYNs aren't there in your labour.
Oh. Yeah.
They will come for the end part. They'll pop in, obviously, and if there's a problem, they'll be there in a heartbeat.
Right.
But you will be cared for on the labour ward. And I strongly advise people to make sure that the labour ward in their hospitals has midwives, not just nurses, because
Right.
midwives are trained in birth.
Right. Specialized.
Yeah, exactly. So I'm not a nurse. Some people are nurses and midwives. I'm not a nurse. I went straight in to do midwifery. That was it. So I would always ask your OB-GYN as well what their cesarean birth rates are and what their induction of labour rates are.
Now, why is that?
That tells us what their rate of intervention is.
Okay.
And it sounds like you're like, well, why does that matter? Well, it matters because we know that generally most interventions in maternity care these days are not indicated. So we want to know, if I'm making a decision and I've got a birth plan, is it going to be respected, or am I going to be pressured into perhaps booking this C-section? Because, if you're being told, I had a patient, maybe 8 months ago, and she was being told from 37 weeks the baby was far too big. She needs to have an induction. And the seed had been planted. And in the end, she actually changed her provider.
Okay.
And she was like, look, if the second person says this, then okay, these two things match up, right?
Right.
And she went on to have a spontaneous birth in the water. Baby was something like 3.2 kilos.
Oh.
Just like perfect.
Which is perfect.
Just like bang in the middle of normal.
Yeah.
But, it's things like that. So you want to kind of know what their intervention rates are, because you don't want to be offered intervention to suit a hospital or a doctor preference.
Right.
Because it's your body, it's your baby.
Yeah. It's exactly what you said. You just want to make sure that your doctor is aligned with 100%. What you both match in terms of like values and
like we're all adults, right? Sometimes we don't gel with each other, and that's so fine.
And that's fine, yeah.
We're adults and we just go, all right.
Exactly. And it's not a one size fits all. Exactly. Yeah. I mean, I find whoever I'm comfortable with. And while you were mentioning it, I felt like this is with any doctor. I feel like there are some doctors.
Exactly.
It doesn't have to be an OB-GYN, like just any doctor in general. Okay. My next question addresses a sad reality that we witness with loved ones, or some people have actually witnessed it personally, which is pregnancy loss. Mm-hmm. I had a friend who recently went through that. There are these influencers, Alexandra and John Bofford, who also went through a loss. And it was a big deal because obviously they have a huge followership, and I don't know them personally, and it hit me really hard. And I think it's just one of the saddest things to hear about and to go through. Mm-hmm. First of all, how do women deal with that? And how do you help women deal with that?
I mean, it's a hard question to answer, like how do women deal with it?
Yeah.
Because initially they don't.
Okay.
And I wouldn't ever expect anyone to deal with it initially. It's a shock. So we know we have like the 7 stages of grief now. There was 5, now there's 7. Mm-hmm. And we know that it's something people never get over, ever. They just learn to live with it in a different way. So it's never something that is gonna be out of their mind, especially if they then go on to have subsequent pregnancies. These couples need a lot more time dedicated to them, a lot more reassurance, a lot more TLC, just that continuity of care. There is basically, all the evidence tells us that the way we, as midwives, as doctors, as nurses, the way we care for families, couples in this period, when it initially after the loss has happened, we can either exacerbate their grief if we handle it badly, or we can help them with their grief. We can help them move through that grief journey that little bit easier.
Okay.
So it's a difficult thing to talk about in respect of like the healthcare system, because there isn't really any official guidelines to follow.
Right.
Like there just isn't. Mm-hmm. And that's what people, like healthcare workers, that's what they need. A lot of us are very prescriptive people. Like, if there's a guideline, people will follow it. And things that we know make a difference, such as encouraging people to spend time with their baby, or using their baby's name, doing hand and footprints, lock of hair, all these things that if we can do, we know that those make a massive impact on the grieving process. They make because we're acknowledging their baby as a baby, not a loss,
Okay.
And any loss is a loss. So some people feel like a lot of women struggle talking about their loss when it's a miscarriage, when it's,
right,
I don't know, say it's 8 weeks, for example.
Yes.
And people almost, they're worried it won't be validated if they're speaking to others about it.
Right.
But you're not just losing a baby. You're losing your dream of being parents. You know, people already know what stroller they're going to have. They're imagining taking their baby to meet their grandparents, to summer holidays, to school, to what will the baby be when he or she grows up?
Yeah.
All of that happens, and a lot of it happens as soon as you see the stick say positive.
Oh, absolutely.
You know?
Absolutely. And it's like your body just releases these motherly, you know, hormones. I don't even know what to call them, but you instantly become a mother. And I think it's a really sad reality. But while you were talking about that, I actually spoke to an fertility expert who was saying that women who have been trying for months or years to conceive, who aren't even pregnant, but like the stick will say negative, mourn a loss. So imagine, you know, when it's a positive and the baby's gone. So I can only imagine how difficult that must be. I actually want to get a little personal. I want to know how you deal with it. I mean, you build a relationship with these mothers and these babies before they even come out. And I mean, how do you deal with it as a midwife?
So I am a bereavement midwife. That's something that I've done for a long time in my career. And where I used to work back in the UK, it was an incredible place that had specialist bereavement midwives. So I learned off them, and you know, very big hospital, very big inner city hospital. You get exposure to these things. So I think what I realized was it's not for everybody. And that's okay. It's a certain part of the career. I enjoy it in a way that I like to be able to like help these people, these couples carry the burden a bit.
Okay.
That's what I like. Obviously, no part of it is ever fun. It's not a fun part of my job, but it is a really, really important part. And I personally, I like to build a relationship. So I have written bereavement policies. I have implemented bereavement training in previous hospitals that I've worked at, because they don't exist.
Yeah.
These things don't exist, and they have to, because we know that pregnancy loss in general is quite a high statistic.
Yeah.
And they're just the ones that are reported, the ones that we know.
Absolutely.
And I will go to either be with these couples as they birth their baby, do all the memory making afterwards. I will go to their house postnatally when they've gone home and they've got an empty nursery, no baby, and just talk to them. And often when you provide that, you're one of the only other people that's seen their baby.
Right.
So it's something that you have in common. And I have a higher number than I would ever like, but I still talk to many of the bereaved couples that I've cared for whilst I've been in Dubai.
Wow.
Like frequently. It's just like a bond that you don't really ever lose.
Absolutely.
But yeah, for me, I think making the difference, making it easier for them to carry, because they'll carry it their whole lives. I just help them carry it for a little while, you know?
Yeah.
But that's what keeps me doing like that part of the job.
Oh, absolutely. That is rewarding. And
so rewarding.
Part of like helping them get through it and actually trying to conceive again, and, you know, helping them through that second journey and reassuring them. And I mean, that is rewarding. As painful as it may be, it is still rewarding.
Yeah.
Okay. We've taken so much of your time, but I just feel like this topic just never ends.
Oh yeah, I could talk about it for years.
I know, exactly. And there's so much to address, like with postpartum and how to know the difference between postpartum and baby blues. And because I know a lot of my friends were actually confused and they thought it was just baby blues. And then, you know, 6 months down the line, they were diagnosed with postpartum depression. So that's actually my next question. How do you know the difference? And how, as a mother, do you know when to get professional help?
So baby blues, they usually last a couple of weeks, 2 to 3 weeks. you have a severe hormone drop when you give birth.
Okay.
Huge. There's not another like it in our lives.
Okay.
And not only do you have this hormone drop, but you have given birth to this baby. And you have either had your vaginal birth or you've had a cesarean birth. Both of these things are physically demanding, emotionally demanding. But we send you home after 2 days with this tiny little newborn. And we're like, okay, look after this.
Yeah.
So you've got that on top of what is a huge physical recovery.
Oh, absolutely.
So the baby blues, they can happen, they're normal. But if you're not coming out of the other side after 2 to 3 weeks and you feel that your mood is persistently low, you have feelings of anxiety, like, is the baby breathing? What if I put the baby in the crib and the crib collapses? Kind of all these thoughts that you think, I know that's not going to happen, but it's going to happen. Not wanting to be around your support network, being withdrawn and closed off, anything like that, loss of appetite.
Yeah.
Loss of appetite, sleeping a lot, or not sleeping at all. And I mean, insomnia, not just my baby's awake and I'm awake. We're talking about really not sleeping at all. And a lot of the time, the first people that see it, it's not us, it's our partners.
It's the partners,
our close family or friends, the people that see us every day.
Yeah.
And I would always recommend, if partners identify that they have that conversation.
Right.
They may well want to reach out to a different family member. Sometimes it's difficult to have that conversation with your partner. But one of the things that we know puts people at risk of postnatal depression is if they have some sort of anxiety or depression or any other mental health issues prior to pregnancy.
Right. Right, which is also something to look out for. I mean, to pay extra attention to.
Sorry.
No, that's fine.
So if that's the case, what I would usually suggest is that they go and see like a perinatal psychologist in the pregnancy. If they feel like it might be something that they're starting to feel come back, the anxiety's got worse, or you're through the pregnancy and the depression is quite heavy for me. So doing that and making a plan with a psychologist for the postpartum, and also having a postpartum plan in general reduces the severity of baby blues. So we plan for our birth. People have a printed birth plan, but what I usually advise is write and print out a postnatal plan. So even if it's something as simple as having your emergency contacts, who can I call in if baby won't feed and I am absolutely up the wall and my husband's back at work, who are the people that I'm calling there?
Right.
Who can I call to drop me off some dinner? Or, one of the best things people do is they make, big pots of food and just drop them around, leave them on the doorstep. That is one of the best things you can do in the postpartum. But who are these people that you could ask for that? Are you going to use a night nurse? Are you going to use a nanny? Who are the people that, who are they? Let's meet them before so I know who's coming into my house. All of these things can really, really reduce the severity of your baby blues.
That's a really good one. I think we seldom think about those aspects, and it makes sense to do it before you give birth, because after giving birth, you're not in the right state of mind to sit down
you're just getting
and
through
plan
your
for
days.
that. Exactly. You're not going to be able to plan out everything. So I like that. I really, really like that. Okay, my last question, I promise. What is your advice for women trying to conceive? And I think I'm asking this question because I'm not even a mother, and I'm still maybe not at that stage, but I get anxious just thinking about it because, again, we go back to hearing all these stories of, people's experiences, be it good or bad, and wanting the good and not wanting the bad and obviously overstressing something that you're still not doing. Like I'm still not at that stage, but I do get anxious and I think about, oh my gosh, what if I give birth and like I don't know what to do, and what if something happens to the baby overnight? And that anxiety, it's real and it gets the best of us.
Yeah.
So what's your advice for women trying to conceive at the moment?
So if you're trying to conceive or you're thinking about it in the next sort of 6 months, you're going to start taking control of what you can control. So by that, I mean, increase your exercise. If you're trying to conceive, you don't need to be going Kurt Raisey exercise-wise, but we want to be doing like functional fitness.
Right.
And maintaining that for at least 3 times a week, I'd say. Okay. Some people like to train more usually.
Yeah.
So fine. Keep that going. If you haven't, I would suggest looking at some classes that you might find interesting, whatever that exercise is, right? It doesn't matter. But what we want to do is we want to put our body in an optimal position for conception. And being active is going to help that. Take folic acid.
Okay.
3 months, if you can, 3 months before, at least. And what we're doing is we're just trying to like make the conditions so optimal for when we're ready. Also, give yourself time. It takes time for most people to conceive a baby. You know, some people say, oh yeah, like it's the first time. It was great. We just got pregnant.
Yeah.
And you're like, okay, great. But you're the exception, not the rule.
Yeah.
But we know that women are having babies later and later in their life. And there is a lot of fear mongering at the minute about your age and you're pregnant, like trying to get pregnant, your fertility decreases. And I see it all over social media, and it's all to sell you sticks that you use to tell you your AMH levels.
Right.
All these things like, let's see what your fertility's like. And I'm like, you don't buy into any of that on the internet.
Right.
If you really want to know what your fertility's like, if it's just going to set your mind at ease to know what your levels are, how does that look for you, you go to see a fertility specialist.
Absolutely.
Don't buy random stuff on social media, because when we use standalone tests with standalone values and no context, they don't tell us anything, but they can fearmonger in women. And that's what's happening. I don't know what it is. There's some sort of like epidemic at the minute on social media about fertility and buy this kit to test your fertility. And no, go to a fertility doctor.
Right.
And also, it's not just important for you if you're trying to conceive. You also have to think about your partner, because if one of you is doing everything they can to optimize it, but the other isn't, that's still not very optimal.
Right. Right. Absolutely. Nikki, thank you so much for everything.
Thank you for having me.
And for your time. We're definitely going to bring you back, because I feel like there's so many questions that I haven't gotten a chance to ask. But obviously you have better things to do. So we're going to let you off the hook, but we're going to bring you back. Thank you so much.
Thank you.